Hi, I'm Melissa, and this is my mini lecture on nonverbal communication. Nonverbal communication is any form through which we communicate that is not using words. 93% of how we communicate is nonverbal, and of that, 55% of it is through our eyes and our facial expression. I can definitely attest to this, as I am somebody who has a terrible, terrible poker face, and anything I'm thinking or feeling shows up right here. I have to make a very active effort to not show that I'm having a bad day if I am at work, especially when patients ask how I'm doing. I do honestly believe that nonverbal communication is the most honest and telling form, and it makes it very easy to do my job. Without knowing nonverbal communication and being able to pick up on it, I do feel that a lot of people would miss out on necessary health care. I say this because people at my job really like to lie to me and tell me that they are doing fine, because nobody wants to tell the aide that they don't feel well, so that I'll go get a nurse and they'll get poked and prodded or have to go to the doctor. They'll tell me that they're fine while they're clenching their wheelchair, or they're sweating, or they're shaking, or their face is red, or they're clenching their teeth. It's very easy, if you pay attention, to see how the people around you are feeling just by reading their nonverbal cues. In fact, I used to be a bartender before I was an aide, and I could always tell when somebody was on a first date based on their body language with each other. If the date was going really well, it would start out kind of awkwardly with that social space between them, and if the date started going well, they would kind of ease up. Their shoulders would relax, they would relax their hands and move into a more personal and intimate space. If the date was going really poorly, they would stay in that kind of social space. A lot of times the girl would cross her arms over her chest and just create a lot of distance between them. It's so important to be able to read these nonverbal cues and be able to understand what the functions of nonverbal communication are, regardless of your job. There are 6 nonverbal communication functions that they really sum up why it is so important to know how to communicate nonverbally with somebody else. The first one is repeating, and this is when we act out or mimic what we say. I do this a lot with my son when I'm trying to keep him on task and I'm trying to direct him. It really helps him stay on task and stay focused versus me just throwing something out there and him trying to figure it out. The second one is contradict, and this is what I was talking about at work. That is so important when people tell me that they're fine and they're very obviously not. The third one is substitute, and this is when you have to say nothing, but you're still giving out a message. Parents are very good at this one. I know that I am. I can give my son a look, and he knows when enough is enough with just one look. Compliment is when you're acting out what you're saying. With my son, when we go to the park, I'll tell him, okay, we're going to leave in 5 minutes. It's easier for him to see a message of 5 than me just say it. He can count this. With words, it's a little bit different with a 5-year-old. The 5th function of nonverbal communication is accent. And this is when we really put an emphasis on what we're saying. I do this with my mom voice. He knows by my tone of voice if I am being serious, and he needs to come here. And he needs to stop messing around. The 6th one is regulate. So the 6th function, like I said, is regulate. And it's how we act in a conversation that's going to influence it on how it ends. When I'm with a patient and I'm really trying to get their trust, I'm going to lean into them. I'm going to make sure that my hands are free of things. I'm going to be looking them dead in the face and make sure that they know that I am 100% focused on them. Now, I do have some patients that really, really like to jibber jab and talk and do all of the things, which is fantastic, except for when I have a really large patient load for the day and I need to get going to see the next person. in that case, I might look down at my watch or grab my iPad and start doing some charting and just kind of start looking around and kind of start just detaching from the conversation. And a lot of times they are able to grasp that I'm not really invested in the conversation anymore, and they let me go a little bit easier. It's so important to know the how and the why behind nonverbal communication, because it's most often how we are judged and how we judge others. And if we're misreading other people's nonverbal communication, or they're misreading ours, our intention isn't going to get across. And especially in a field like the medical field, you need to be extremely aware of how you are coming across with other people. So this was my mini lecture on nonverbal communication, and I hope you enjoyed it. Thank you.